healthy again, but there's three parts that are crucial to do working with that. Because if you're just rehabilitating malnourished children and then putting them back in the same situation they came from, you're not really doing anything. You can, give each other a high five, slap each other on the back, say, yeah, we did something good, but they're just gonna return to the same level of malnourishment that they came in with. So the second really important part is follow through. We work with all the families after a child has been released in order to give them what's seguimiento in English? I forget.
A second term?
Seguimiento is.
Segment?
I think follow through. Follow through is a good word. So we do that, and then also while the children are here in our center being helped, we send a social worker to their houses to ask the question: why did this malnourishment happen to begin with, and what can we do with this family so that when the child's ready to be released, the family is ready to receive them and nourish them, and we have the resources to take care of them, resources and the education. When this center opened, we had a fully stocked staff, we had all the equipment we needed, we had cribs, we had baby clothes. The only thing we didn't have was malnourished infants, which is very odd in the country that has the second highest malnourishment rates in the Western Hemisphere, sixth highest in the world. We're second only to Haiti in the Western Hemisphere as a country, Guatemala. And one of the reasons we couldn't get children here was because of the difficult mentalities we were dealing with in the areas that had the highest rates of malnourishment. We were working in a community called Santa Maria de Jesus, which has about 80% malnourishment rates for all their children. And there was a rumor going around that the only reason we wanted to bring their kids here and get them better was to eat them. After we had fed them up,
way.
we were going to eat them.
It's very Hansel and Gretel-ish. It is.
Yeah, and we can laugh about that because it sounds ridiculous. It sounds like something that might be in the Family Guy or something. But really, these are people who don't have a lot of education. And so it's kind of like one person, the town crier might say something like, oh, they're going to eat the babies, and 100 must believe that. So in that community, we have identified 6 children who we thought really need that admittance, and our triaging criteria is the bottom third of the bottom percentile of malnourishment. So even though we'll get some cases of mild to moderate malnutrition, ideally we want the babies who are severely, acutely malnourished and need some sort of intervention in order to save their lives. So what happened was these 6 children we identified, 5 of them, as we predicted, passed away, and they died. And so the 6th one, the mother was willing to then give us a chance, despite the rumors going around that we wanted to eat their babies. And that family, his name was Orlando. They have a new house now. They have a donkey that was donated by a man named Vince, who's from North Dakota. I forget his last name, but and now they also, we did hydroponic gardening tables with them. And really, the important thing is just education. And we would be surprised at how many 6-month-old babies I met who drink 6 bottles of coffee a day and tortillas.
No.
That's their diet. So if you tell them that they're malnourished,
that's my diet.
if you tell their parents, hey, they're malnourished, even if they believe you, because a classic symptom of malnourishment is a bloated belly, which makes them appear overweight, not undernourished. But even if they believe you, their solution is going to be more coffee, more tortillas. So you really have to teach them about their own biology. You have to teach them about nutrition, sanitation, and we have a number of strategies we employ. Each case is different. Some cases we'll have to put a water filter in their house in order to, and we'll see the filter. It's a really simple $12 bucket through clay filtration system. Some of them will want to do microfinance chicken projects with microfinance hydroponic gardening tables. If they're living on a dirt floor, we want to have them living on a cement floor. So service teams like the University of Mary service team that's here right now, a lot of times those groups are building houses for families who have children in our malnourished infant center.